As we all know, the COVID-19 epidemic has had a profound impact on the American economy. It certainly has had a profound impact on the Ohio economy as well. Prior to the onset of the coronavirus pandemic, Ohio's economy was strong and our budget was on track. For example, by the end of February, state revenues for the fiscal year up until that point were ahead of estimates by over $200 million. That was at the end of February for the year. We now have figures in for the month of April. Our fiscal year-to-date revenues have taken, as you can imagine, a rather dramatic turn just in 2 months. We are now below the budget estimates for the year by $776.9 million. So as you can see, that is a turnaround, going the wrong way, of close to $1 billion. Just to put this in perspective, $1 billion per month is what the state pays and spends on primary and secondary education, as well as to our state colleges and universities each month. That's each month. Our Office of Budget Management Director, Kim Murnix, and her team are projecting that state revenues will continue to be below budget in the coming months as we move through this crisis. Nationwide economic forecasts have, of course, been very unpredictable. The forecasts, as well as OBM's projections, indicate to me that we need to make significant changes to our state budget to prepare for the coming months. As I have said, this is certainly no ordinary time, and we cannot continue onward as if this was a normal period of time. In Ohio, we, of course, have a 2-year budget cycle. Each fiscal year runs from July 1st to June 30th, and we are now starting the 11th month of our 24-month budget cycle. The budget has to be balanced throughout that entire period of time, and it has to be balanced by the end of each of those separate years. Unlike the federal government, we have to balance our budget, and we intend to do so. So today I am announcing a $775 million budget reduction in general revenue fund spending for the remainder of 2020. That means that we have to obtain these $775 million in cuts in the next 2 months. Decisions like this are certainly very difficult and unpleasant, but they are part of my responsibility as your governor to make. While we do not know what the coming months will hold, we do know that COVID-19 is here with us and will be here with us for a while. That does not exempt us from the obligation to balance our budget. Making difficult budget decisions now will help us down the road, and it will help us while we continue our discussions for the next fiscal year budget. Let me explain a little bit about that. I have decided to not draw down the money from the rainy day fund for the next 2 months. We have decided to make cuts which will enable us to balance the budget for the next 2 months. And I'll explain this in more detail in a moment. But simply stated, we are going to need that money, that rainy day fund, for next year and possibly for the year after. The cruel nature of an economic downturn is that at the time when you are in need of the social safety net, it's also the time when government revenues shrink. We're trying to preserve basic services for people while we get through this period. And one of the things that we're going to try to achieve is some stability. Let me again return to the rainy day fund, because I know we've received a lot of questions. Are you going to pull down the rainy day fund? And the answer is yes, we will. We're just not going to do it in the next 2 months. I know that I have said that it's raining, but we really do not want to tap into that fund yet. This rain is not a passing spring shower. It could be, we don't really know, but could be a long, cold, lingering storm. We should not use that rainy day funding until we have to. None of these decisions are easy, and I do not make them lightly, but they are necessary. As many of our businesses and our citizens of the state of Ohio are having to make difficult decisions, it is incumbent upon us in government to make those same decisions. I want to outline briefly where these cuts will be made. And again, these are cuts that we'll be making for the next 2 months. We will reduce Medicaid spending by $210 million. K through 12 foundation payment reduction will be $300 million. Other education budget line items, $55 million. Higher education, $110 million. All other agencies, $100 million. And that totals up to $775 million. Of the money in the budget, that is Ohio taxpayers' money, only 9.4% is spent on operating expenses of state agencies. Over 85% goes out across the state as subsidies to schools, higher education, Medicaid services, local government, etc. So most of the budget does not get spent on state agencies, but are really transfer payments that go out to our local communities and to our local schools throughout the state of Ohio. Any cut to education is difficult, but we have an obligation to do our best to balance these cuts and to protect the most vulnerable of our students. And we intend to do that with these cuts. Further, while no one can predict future revenues or exactly where our economy is going, we need to do everything that we can to try to ensure stability in funding for our schools and some predictability as much as possible. We have an obligation to our schools, to our students, to our parents, to give them as much predictability as we can. And so if we do not make these cuts now, over the next 2 months, the cuts we will have to make next year would have to be more dramatic. Now, with regard to our state agencies, each of our agencies, with the exception of the Department of Rehabilitation and Corrections, is taking cuts, including the governor's office. Regarding our state agencies, on March 23rd, I initiated an immediate hiring freeze for state employees and state agencies, boards, and commissions. That continues. I also ordered a freeze on pay increases and promotions of unclassified and exempt staff and a freeze on new contract series for the states. That continues. I've asked each agency director to continue to identify additional savings in their budgets for the remainder of this fiscal year and for next fiscal year. Moving forward, all state agencies will continue in the hiring freeze as well as the freeze on pay increases and promotions. State agencies will continue to operate under the travel freeze already in effect, with exceptions for those staff providing direct services in regard to this emergency. Further, agencies will immediately freeze new requests for contract services, except for those services that are necessary for emergency response, and will strictly scrutinize the continued need for those services. Agencies will suspend purchasing authority for non-essential purchases with continuation of only mission-critical contractual services. those are the decisions that we are making for the next 2 months. We have been in contact with the legislature about these. I bear the responsibility. We will continue to discuss with the legislature where we will go with next year's budget, which will be immediately upon us. And I look forward to consultation with the minority leadership as well as the majority leadership of both the House and the Senate. Let me turn now to the Lieutenant Governor, John Husted.
Thank you, Governor. Good afternoon. I wanted to just expand a little bit on some of the things that the Governor just announced. You know, it has been my privilege to serve in public office in both the legislature and the executive branch. And so I've had a chance to go through difficult budget decisions over time. We went through them after 9/11. We went through them after the Great Recession. And now we're in the midst of the global pandemic that coronavirus has created, and there are both health and economic consequences as well as budgetary consequences. In all of those times, I can never recall a period where we went in basically a 2-month period to having $1 billion swing, from having more revenue than we had estimated to having far less revenue. $200 million overage to a $779 million shortfall. That is the most dramatic swing I can ever recall. We don't know how long it's going to last. The economic consequences, the budgetary consequences could be shorter, could be longer, but it's prudent, as the Governor mentioned, to plan for the long haul. In the end, this is about providing as much stability to the people out there, because that's where most state government goes, where state government money goes, is outside of state government. It goes to schools, it goes to healthcare providers, and I'm going to touch on that in just a minute, but we have to plan for that future. And Eric, if you could put up the blue slide or the pie chart there. This, I think, really gets at the heart of it. If you look at the three pieces of the pie, the gray is essentially debt service. That's what we pay out of the state budget for debt service. The green is what you would call administration. That's all of the elected officials and the courts and everything that it takes, legal, administrative, all of that to administer state government. It's not a huge part of the pie. The blue is everything else. That's the money that goes out the door for Medicaid providers, it goes out for K through 12, goes out for higher education, and for local government. And that's the challenge that we have. That's why when you see money that gets cut from the things that we dread cutting them from, schools, Medicaid providers, and the like, it's because the state has to balance its budget, and that's where all the money is. The green piece of the pie and the blue piece of the pie are getting its cuts. Everything else is debt service. And I just wanted to put that in perspective for folks so that they really understand how the state budget works. We balance the budget. Most of the money we have goes out the door to serve other people. And that's the nature of how state government operates. I do want to say this as well, that, and I've talked about this for a while, it's a health crisis that in response creates an economic crisis with budget consequences. That's not just at state government. That's for our local government friends in this state. That's for state government. It's a federal issue. It's a global issue. This is an economic crisis that's not unique to Ohio, and while we're opening things up in Ohio, that's not going to solve the global economic consequences of of what we're facing. That's why it's important when you hear what we've been saying here over the last few weeks about learning to live with coronavirus in our lives, protecting lives and livelihoods, and doing two things at once. Those are kind of the themes that you've heard often, because we know that we have to get the economy moving so that people can pay their bills and so that the private economy, which funds public services, can be as robust as possible. They all fit together. And we have to design a policy. The governor is in charge of designing a policy that meets all of those needs, that tries to put people back to work, that gets the private economy going so that we can fund that social safety net that education and children depend on, that healthcare and people who need healthcare services depend on. It is the social safety net that is critical to our lives. And so that's why all of this has to come together at once, why it's so difficult to piece these pieces together in a way that strikes that balance. And I really believe that we are in a great position because of the early decisions, because of the early warning that Dr. Acton provided, because of the quick action that the governor undertook, because of the partnerships that we have with business that is talking about how we can safely return to work, protecting employees and customers, beginning to get the Ohio economy moving so that we can serve everybody that depends on both work and public services. So I really believe that Ohio is poised to do this as well as any state in the country. And you're getting from us at these podiums every day a bit more of what those plans look like. It is moving forward, and it will all depend on how we pull together to make sure that we're doing the things in our private lives to keep us healthy, to not spread the coronavirus, so that we can get the economy back working, get people back working, and help to provide for the services that everybody needs. Thank you.